Hi everyone, this is Colin Hung from Healthcare IT Today. Thanks for joining us for another video interview. Today I'm joined by Callie and Geeta from Greenway, and I'll have them both introduce themselves. Callie, you first.
Hey, thanks, Colin. Yeah, glad to be here. So, Colin Durgampudi, I'm Chief Technology and Innovation Officer at Greenway Health. I've been here for about 15 months, and I come from a software engineering, AI, NLP background.
Awesome. Geeta?
Colin, thanks so much for having us on. I'm Geeta Nayyar. I'm the Chief Medical Officer of Greenway Health. I'm a rheumatologist by training. I'm up front and center on all the work, COVID, that's happening right now, and have really built my career in health tech. Used to be the CMIO for AT&T, so I've done a lot with mobile and telemedicine. So I'm really jazzed to see where the industry is going right now. So thanks for having us on.
Yeah, thanks for being here. This should be a very fun conversation. So Geeta, first of all, congratulations on being named one of the most influential women in health IT by HIMSS. And I know you and I are both disappointed that we're not able to see each other at HIMSS. That's an annual thing that you and I go to, and we hug each other whenever we see each other. So, but in hindsight, of course, it was probably a good thing that it was canceled now that we know everything that's happening.
Definitely. Well, I look forward to an elbow bump, and I got an amazing dress. It'll have to wait till next year. Thanks, Colin.
There you go. No, but let me ask you this question. What were you hoping to see at HIMSS, or what technology trend do you think you would have seen had that conference happened?
Sure. So, I'll answer this in two parts, right? So pre-COVID-19, what I was expecting to see at HIMSS, right, was a lot of stuff about specifically artificial intelligence, predictive analytics, population health, value-based care, a lot of the things we've all been talking about as an industry for some time. Post-COVID-19, what I would say is that it's clearly about telemedicine, doubling down on telemedicine, telehealth, patient engagement, all about how to engage with patients as we think through kind of what I'm calling the acute, stable, and recovery phases of COVID-19. And then, lastly, I think that it's not that AI is off the table, but it's how AI will fit into all three of those, right? So is there a value add that AI brings into the current problem set and the solutions that could evolve? But it's beautiful to see where telehealth has gone. I'm really stoked to see it evolve. So next year's HIMSS is going to be really interesting.
I think the funniest statement I heard was, we probably had more telehealth visits in the last 2 weeks than we've had in the last 2 years, right?
That's right.
The explosion of adoption has just been crazy. I like that, and I think some of the things you're talking about, I wish we would have seen those at HIMSS, but in the post-COVID world, I think we're happy to all see that telehealth is experiencing the growth that it is. Actually, that's one of the things that I wanted to ask you about, Callie. You wrote in a recent panel discussion, you mentioned that Greenway had created a collaborative space or some space to allow your customers to share best practices and support each other. Can you maybe talk to us a little more about that?
Yeah, so we've actually created a COVID-19 resource page in the center. It's right on the website, as well as some information behind our login pages that are accessible to customers. So we've created pages for CARES Act. We've created information about CARES Act, about billing resources, about templates and workflows, digital health and telemedicine. So we've created not only to help our customers help their customers, but also help our customers, cope with some of this, as well. And we've also created a center where, best practices can be shared. So, for example, one of our centers came up with best practice on OBGYN, and we were able to quickly share that across the board with other OBGYN practices, using our different channels of information that we have on, My Greenway, greenwayhealth.com, and the COVID-19 resource page.
And Callie, what's the response been to that space that you've created? How have the customers started to use it?
It has been really phenomenal, Colin. One of the stats I can give you is, we're not tracking quite the visits on the web page yet. When we do a normal webinar, usually about 400 people register and 200 users show up. When we did a webinar on our billing resources and some of this, over 1,500 people registered, to a point where all of our lines have been taken up, and we had to do a second one, and out of which all 800 plus have all actually showed up, to listen to that. So it has been really overwhelming response to that, and we're really glad to be in a position to actually do that for our customers and help them in this unprecedented time.
Cool. Well, and thanks for sharing that. I mean, it's pretty exciting that you guys are doing some special things to handle the pandemic. But I want to ask you, since you guys do work with so many physician practices, you know, there are a lot of people who are really worried about what the future looks like for that segment of healthcare, whether or not physician practices are going to just totally disappear, are they all going to go run and join hospitals? Are you concerned, or do you see signs of hope? Maybe Geeta, we'll start with you, and then we'll go to Kelly.
You know, I think we're going to see all of the above. So I think, man, if physician burnout was bad, we have major physician burnout issues, right? So any doc that was thinking about retiring, any small business that was sort of teetering on what a financial model was going to look like this year or next, I think a lot of people are raising up their hands and saying, you know what, I'm gonna tap out. I've had a good ride. Similarly, those that were maybe thinking about consolidating, going to the hospital side, becoming a salaried employee, this is kind of their time where they're looking at their bank account, they're looking at, frankly, putting their lives at risk, and they're saying, you know, the math doesn't add up, I'm probably gonna have to close up shop. Now, all of that said, I think I think the summer is really gonna be telling, right? If stimulus bills come out, if they carve out something special for physicians and specialty practices and physician practices, I think we could go back to how we were before. But I think there's no doubt that we're going to have workforce shortage issues simply because of also the mortality and morbidity of this affecting healthcare workers and continuing to affect healthcare workers predominantly. And then there's the surgeons, right, which are in a special situation where the elective procedures are off the table. So you literally have orthopedics and colleagues who are neurosurgeons, and they are walking around unemployed, right? Essentially, they've got no business. So it's going to be a really dicey few months, and I think it really is all incumbent on how we as an industry come together and put forth ways to salvage these practices and also help them pay it forward, because I think one thing we've all appreciated too is how much we need our doctors in our communities. So, you know, I'm hopeful that we will come up with some creative solutions.
Kelly, what are your thoughts?
Yeah, and I think, you know, so to me, you know, there will be, I think, curves. So today, physicians who are very, very busy, I think will go through a down curve, but then, you know, the physicians that are not busy today will go through an up curve. And so my hope is that it balances out in some of the pressure that the system is in order to balance this out. So I'm more hopeful, you know, than not. But I think, you know, Dr. Geeta is right in the sense that there will be some practices that may, you know, be very difficult to come back or have time to come back. Either way, whether you're on down curve or the up curve.
And one more point I'll make, Colin, too, is I think because of the overnight nature of telehealth and its embracement both by physicians as well as by patients, is we're going to see practices that either go virtual or do complementary, right? They're going to do off-hours telemedicine combined with brick and mortar or extended hours. So there might be some offices that are getting really creative in their business models and how they've sort of gotten through this, and what the new normal of a doctor's office is going to be different for forever, I think, now.
Yeah, that to me is the sign of hope that I'm seeing, is that physician practices are starting to realize that maybe they can practice differently. More telehealth, maybe don't need a big waiting room anymore. Maybe joining forces with other providers to provide more of a one-stop shop rather than having them go to multiple places to get the care they need. All of these now are things that I think people resisted before, or just the momentum wasn't there. And now with the pandemic, it's kind of, why would we not think that way? I think it's causing a lot of people, and that's also what's giving me hope. So, but I do actually, one of the things I'm interested in exploring a little bit further is something you just talked about, Geeta, which is this next wave of the pandemic, right? And I don't mean like the next wave of more COVID. I mean the next wave in the sense of all these people who have had their elective surgeries postponed, put off, the numbers just keep growing, and that's the second wave that we're going to have to handle. What are some of the technologies or best practices or things that you think are going to be helpful when that wave gets released?
Sure. So first of all, learning from the first wave, right? So how do we get smart about resources, whether it's PPE, whether it's staff, so whether we move a wave of people who helped out in New York that now come to the Southeast where the next wave is sort of going to be, telehealth, telehealth, telehealth. So, and I don't mean just telemedicine, right? So not just the clinical visits, but how am I monitoring your finger sticks at home with your diabetes? You know, the different technologies out there that do this. How are we thoughtfully taking care of patients who don't have COVID-19 as much as those who do, right? So my asthmatics, my diabetics, my hypertensives, what am I doing to make sure they can check their blood pressure, their finger sticks, even without fancy technology, by the way. Go on Amazon, order a blood pressure cuff, get a weight scale, and get a pulse ox. You don't need to Bluetooth enable, we're all home, right? So let's like go back to just bare basics. When we were on paper, this is how we did it. So I think we have to use common sense. I think we have to get really resourceful with how we think about practicing medicine. And then lastly, I think a lot of offices have gotten really creative about workforce management. So the idea that, again, you know, you've got offices that are trying to stay open while they're closed. So they're doing telehealth for the most part, but then they're open Tuesdays and Thursdays for the patients who really got to come in. So those Tuesdays and Thursdays, you got to make them count, right? So you're seeing all the really sick patients. So how do you triage and schedule those? And how do you also take that staff and make them work for 2 weeks, and then they go on the bench, and then the next staff comes in. So whether you're dividing doctors up for, you know, 1 nurse per doc, and they go in for 2 weeks, and then the next shift. So we're actually seeing shift work in the ambulatory space, which has never happened before. That's an ER sort of thing. But because of the nature of this, if one of the healthcare workers becomes positive, you've now not infected your whole staff. So you can stay afloat and keep, again, because this is about capacity, right? So flattening the curve is doing all these different things dynamically, but it does require creativity and a lot of ingenuity. But I would say there are plenty of lessons to be learned across the globe now. So we should just full on look at those to get through the second wave, because there are many countries that have gone through all their waves. So it's not just domestic.
Yeah, and you know, and from a technical standpoint, you know, I think, you know, to maintain that, exactly as Dr. Geeta said, you know, flexible logins, flexible licensing models, you know, creating integration aspects of it between home health devices, even if it's manual, you know, to Dr. Geeta's point, is there a place where portals you can actually click in your information, you know, even if it's a poor man's way of doing it, so even without that. And then obviously, you know, telehealth and all of that stuff. So, and then from a fundamental shift standpoint, to be able to capture the you know, we were thinking of capturing, you know, speech and audio and video in a physical environment. You know, how does this happen in a virtual environment, you know, aspects as well. So I think those are the ones that, and so, you know, we call it the, you know, we funnily call it the re-entry task force. We actually need a re-entry task force for the ecosystem to be able to tackle both the, you know, the physical challenges and the technical challenges.
That's right. And there's one more point I'll make, you know, is there have been a few folks I know that are doing telemedicine. A lot of colleagues have called me and they don't know where to put their camera, they don't know where to put their lighting, they don't know what to do with audio. So those are great points, but you're only good as the information we give in and out. So I think some tutorials on website manner as opposed to bedside manner. Nobody wants to look at your nostrils all day, particularly when they're anxious and also having mental health issues right now. So all of this is really leapfrogging the industry. Everything we've been talking about, everything Kali's so eager to launch. I mean, this is like, everything's fair game now, and it's brilliant. It's terrible that it took this to happen, but I think it's brilliant.
Yeah, I think, you know, we were waiting for either a slow pace of change or a revolution, and you know, so this is the revolution that's actually going to accelerate some good change, right? I mean, we're going to deal with some bad change as well, but hopefully we can take advantage of the good change.
Are you seeing any of these changes on the horizon that are going to impact your product timelines and your product development schedules?
Yeah, for sure. I think we are now in the process of accelerating, you know, telemedicine. So, you know, AI, telemedicine, NLP, speech, interoperability were the key 4 or 5 things that we were working on anyway. So now it just becomes more important. So, you know, 21st Century Cures Act, for example, it's not an optional thing anymore, even if we wanted to. So, you know, not that we weren't supported before, we're now doubling down on that technology. Same thing with telemedicine. You know, we at Greenway don't have telemedicine built in. We have lots of partners and we're able to make it work, but we would love to build into that. And we would love to now, change the paradigm of capturing speech and NLP and all of that stuff, the audio, visual, video thing via telemedicine. In some cases, it becomes easier because I don't need to worry about where to put the camera and where to put all that. It's all there. The devices are being that you capture, whether it's phone or computer, are going to help you capture some of this stuff easier. So we're frankly looking forward to some exciting changes on the technology side, and yes, there will be roadmap impacts.
And Geeta, what are you seeing, or what are you hearing from customers in terms of future needs that were unforeseen prior to the COVID situation?
Sure. So, I mean, other than the basics of PPE and workforce management, right? I think recovery is going to be really, how do we go back? So first of all, I think there won't be a going back to normal. There will be definitely a new normal doctor's office, which is not a bad thing for all the reasons we said. But I think it is, how do I get my most valuable office visits in from a revenue recovery, right? So that annual wellness visit, the more expensive sort of elective procedures as opposed to those that can wait. How do I do population health management in a lot of ways, right? And then how do I do kind of revenue cycle management in a lot of ways? And then how do I go to an ecosystem where I'm doing telehealth and telemedicine? Because now I have a patient population that expects that. We are all assuming the reimbursements will stay afloat and the regulations will stay open. So how do you transition your office to now offer that, but also go back to a brick and mortar? So it is different. And I will say that one of the cool things about what has happened in this sort of revolution is it's kind of value-based care playing out. It's kind of patient responsibility playing out. It's all the things we've talked about in the industry for so long. It just all got thrown into the spring. And so I think you're going to see patients who are also now like, okay, what was that medication? And okay, I'm going to take it, and I don't want to come back to the office unnecessarily. So how could we do this in a telehealth visit and not an ER? So it's kind of amazing to see all of that happen. One of the things we've done at Greenway too is just when it comes to claims. So one of the big concerns a lot of physicians have is, am I actually going to get paid for this, or did they just say that, right? And then we're going to get them through the crisis, and everyone's going to forget the frontline docs, nurses, and care team that did all of this, because it's clear that also those back-end systems were not built for this. So a big part of what we're doing at Greenway is helping them to make sure their documentation is correct for telehealth, independent of their technology, making sure their order sets, their claims processing. So we are doing all of that, but that's one of the biggest concerns docs have, is they're like, I've never been paid for this. I don't even know, right, what to expect. So they're looking for all of that and more, and how to just stay healthy, right? How to keep their staff healthy. And for pediatricians, particularly, they're going to have a tough time because it's back to school August, September. We're all assuming everyone will be back to school August, September. So how do they manage the recovery phase of doctor's notes, well visits, all of the general? August, September is high season for every pediatrician across the country. So how do they manage that with also the recovery sort of high season of COVID-19 is going to be a challenge.
Wow, you bring up an excellent point around that September, August timeframe in pediatricians. I hadn't even thought of that in terms of the crunch of not only not having seen patients physically for so long, all coming now, and then the school year hopefully starting up, and the need for all of those visits to get done in that crunch period. You're right that maybe shift work is going to be a reality, not just for safety, but just to get through the volume.
Yeah.
So these are really interesting, and it sounds like Greenway is really reacting very quickly to the needs of clients. Maybe you can share with us, how are you gathering that feedback? Is there anything that you're doing, engaging them in new ways now that you can't physically go visit them?
Sure. I mean, I'm happy to just give some color, and then Kali, I'll toss it to you. I mean, we're doing everything we've done and more, right? So again, the typical ways we interact with our customers, like any vendor, email and such, but now we're doing a constant webinar series. We're actually also getting our practices together just to group up collectively and have conversations about what's working for them, what's not. Again, independent of our technology, we want to facilitate practices being able to be open, helping them understand what PPE might be available in their regions and how they can help and learn from each other, telehealth best practices. So we've done everything from engage on social media, webinar series, our new SharePoint site, which is dedicated just to the crisis, as well as our typical kind of customer support avenues and ways to call in. But I mean, there's really no aperture that we've left unutilized, and the feedback is tremendous, because definitely every provider is looking for their trusted advisor. You know, for us, it's obviously our physician mix, and it's our time to really work together and do our part and really help our doctors keep their offices open while they're closed. That's really kind of how we're looking at it.
I love that term. Kali, what about you?
Yeah, we formed a multi-functional task force to be able to gather the feedback and stuff like that. So all the channels that Geeta talked about, are coming back to us, and we're collecting that feedback and then reacting quickly to that feedback. And so, our webinars and some of these are changing on a weekly basis, sometimes multiple times a week, in order to actually keep this feedback coming. We're also seeing, a lot of information has been just like, COVID graphs, a lot of information on CARES Act and CURES Act and everything else is also changing on a regular basis. So we're able to keep up with all of that stuff and push that information out. And in some cases it may be a little bit over communication aspect of it, but we'd rather over communicate rather than under communicate in these circumstances, because we want to be helpful to all the constituents in all the matters.
What's the one thing you hope that viewers will take away from our discussion today? Kali, we'll start with you.
Yeah, I think I want everybody to take away how the ecosystem and everybody has been come together for this, right? So I want us to remember that we've all come together as an ecosystem, as partners and friends and relationships, and so we need to build on that and take it forward, because this has been truly a team effort in supporting all our key frontline partners and workers.
Geeta?
Yes, I would say the same. One is please stay home, independent of what happens. It's too early. A lot of things for true recovery to happen. I call it the 3 T's. We need testing, tracking, and treatment. We don't have any of the 3s ubiquitously available. If I wanted to go test for the flu today, I could just go to CVS and do it, right? That's what's got to happen for COVID-19, period. So I think it's being smart, protect yourself, and talk to your doctor, right? Talk to them about July and August and September and what that's going to look like. So I think being proactive with your own health and thinking through your own family's needs, if you need prescriptions and things before the second wave hits, to do that. And from a customer perspective, I don't think there's a customer out there that has not heard from us. I mean, we are here for customers. We are doing everything we can as a vendor to enable telehealth, patient engagement, and just good best practices in medicine. So we are very much here for our customers, and even if you're not a customer, we're really trying to do the right thing.
Awesome. And Kali, let me ask you the final question. Where can someone go to find out more information about what we've talked about today?
Yeah, so greenwayhealth.com, there's a section on greenwayhealth.com on COVID-19 resources. That'll be the first place to start, and there are links that branch off there. And then one last thing I would add is we've done things like offer our partner services, regardless of whether they are beneficial to us or not. We've offered services on chatbots, even though they're not directly linked to our providers. And so all that information we're trying to do as best as we can in this time. And so, but it's all there on greenwayhealth.com and COVID-19 Resource Center.
Awesome. Well, thank you to both of you for your time. I know you're both very busy. We do appreciate the time you spent with us today, and thank you for all the information you shared.
Yeah, thanks for having us. It was a pleasure.
Likewise, Colin. Great to see you. Thanks for having us on.
Great. This is Colin Hung from Healthcare IT Today. Thanks for watching.